one of the things we want to keep in mind about this vaccination is because of the pandemic, the federal laws in particular that regulate what employers can do, especially with regard to vaccines and other medical related issues, they pretty much have gone out the window. And there's a special carve out actually in those laws for pandemic type situations, not just this one, but if there was another one. And so they give employers great latitude to do things that in normal times they would not do. So the key there is, you want to think about whether you mandate vaccination is this is going to be a short-lived thing. It's not going to be something you're going to be able to keep doing after we're out of the pandemic. So do you really want to change all your policies and so forth? Secondly, there are a couple exceptions for vaccination mandates. One is for people who have a religious objection to the vaccination, and also for people who are disabled in some respect that they aren't able to subject themselves to the vaccine. If you have an employee that refuses to be vaccinated for one of those reasons, either religious beliefs or they have some kind of disability that might cause a problem for them, you're going to need to communicate with them about that, and you may not be able to mandate that those individuals get vaccinated. So just be aware of that. Also, the doctor earlier showed information about pregnant employees. Pregnant employees were not part of the test pilot, and so you cannot make a pregnant employee get vaccinated. So that would be another category that would fall in there. And then the last piece before I turn over to Brittany for the next question is this protected activity I'm mentioning at the bottom of the slide. So the National Labor Relations Act, which is a law that most people think only applies to unionized workplaces, actually applies to both unionized and non-unionized workplaces. And what it provides for is it says employees at any employer, even if it's non-unionized, they have the right to engage in discussions and protests with one another about the terms and conditions of their employment. And when we think about terms and conditions, that can be anything. That can be wages, that can be vacation pay, that can be work schedules, and it also includes vaccines. So even if you're in a non-unionized company, be very careful if you have a couple of employees getting together and expressing opposition to something about the vaccine, that you don't inadvertently step afoul of that law and end up with what's called an unfair labor practice. So that's the big key on things to think about mandating the vaccine. I will tell you that most of the companies that we deal with, and it's a huge number, they are not mandating the vaccine outside of a healthcare industry setting.